Welcome to We Question and Learn. This is Tom Pies. We're celebrating our 20th year here on the air at WQLN FM 91.3. We're on NPR One, the WQLN website, and about a dozen other podcast venues. Very happy to say good morning to Debra Thompson, President of Strategy Solutions.
And good morning, Tom. It's always lovely to be with you.
Thank you for that. I'm so proud to be able to speak with you. You do advanced training and strategic planning, quantitative and qualitative market research, quality management, leadership development, systems thinking, and facilitation through affiliates of, I think this says MIT, am I right?
Well, that's where my training came from, yes.
Excellent. Deb is a licensed consultant, trainer, and peer reviewer for the National and Pennsylvania Standards for Excellence and Ethics and Accountability Code for the nonprofit sector. And I could go on with the rest of your resume and the numerous awards you've received, and your 20-year career has paid off well for you because your name is very commonplace in the nonprofit world in a very, very good way. And I thank you for taking time out of your busy schedule to be with us today. May I ask, what is your latest project?
Oh, I have actually too many to probably list. Quite a few that are interesting. And I guess one of the things that I'll talk about is the last 2 weeks in a row. This past week, just this week, Jackie and I were in Harrisburg and in State College the week before with the Pennsylvania Library Association this week and with the Pennsylvania Association of Nonprofit Organizations last week doing board governance training for those two associations.
This is critical. We've known each other a long, long time. We've spent a lot of time discussing particularly one group that you consulted. And I was going to ask, now that we're in, say, the third quarter, near the end, actually, of 2024, what's different than, say, a year ago or even post-COVID or even pre-COVID as you travel around the country and start to help people cope with society as it is today?
Well, that's a really provocative question. And I think there are a number of things that we're experiencing, what I'll call huge demographic shifts, okay? People are different. I think people are different and society is a little bit different now post-COVID. I think that things have changed. And one of the things that we've noticed in, I'll call it in leadership circles, that there's I'll call it a tsunami of people retiring out of companies, both for-profit and non-for-profit. And that is creating a unique set of challenges for both of those kinds of organizations. And we're also seeing kind of a change in, I'll call it leadership understanding in the nonprofit sector and what it really means to be a board member and what it means to govern an organization. I think in what I'll call leadership continuity, especially in the nonprofit sector, we had a hiccup in the ability to train and onboard good board members. And what's happening is that a lot of nonprofits are seeing a lot of dysfunction today as a result of that. And it's just in terms of the demographic shift, both for-profits and non-for-profit organizations have a very strong need right now for succession planning and transition management. In for-profit companies, they have to, in order to survive, they often have to make sure that they have good leadership, especially in privately held companies where, sometimes if the founder retires, the company goes away. And that's not good for our communities. And it's actually not good for the economy. So we need to be thinking about how we equip business owners to transition their companies and to potentially even sell them to help augment their retirement income as opposed to just closing them when they retire. And, helping our nonprofits be able to have good leadership transition when, longstanding executive directors decide to retire.
I've been seeing this, I would say for the last 5 years for sure. And as you know, prior to that, what do we do to help young people understand the value of our nonprofits? I actually sometimes see they don't measure the value. And I'm thinking of medical nonprofits, as you know, which are very important. You worked in that industry, but just general service organizations that do things for children, for example. Are they missing the story, or is it just my bad perception of how they cannot see maybe the need for this kind of help for the nonprofits in our communities?
You're raising another very provocative question, Tom, which you always do. And I think if we look at the younger generations, I think that they're, I'll call it bifurcated or divided in their understanding. Okay? I see a lot of young people who are really bright, they're inquisitive, They're learning, and they really understand what's going on in the community. They understand what's going on in the nonprofit sector. They understand the complexity of community issues that are happening in the world. Okay, and I say that because, my side hustle, if you want to call it that, I'm an adjunct professor at the University of Pittsburgh Graduate School of Public Health, and I also teach an undergraduate course. So I have the interesting good fortune to interface with either undergraduate or graduate students every semester. And I will tell you that there are amazing young people, and even those that are what I would call young professionals in their 20s, 30s, and early 40s that really get it. But then on the other side of that, there's this other population of folks who are just, I guess my observation about it would be just focusing on survival. That they, many of them have to work 2 and 3 jobs just to make ends meet. And they're raising families, and they're trying to figure out how to survive in this chaotic world. And they're just not aware of all of the issues that are going on in the world, the way our generation was when we were younger. Okay, and especially if we had professional jobs, one of the big shifts that I've seen happen over the last 20 years, and it's actually continuing to get worse, is the fact that companies many years ago had staff capacity and encouraged people to get involved in communities. Now, some companies still do that. There are many companies that are very community minded. And I'll mention one, Erie Insurance, for example. Mm-hmm. Their staff frequently do nonprofit and community cleanup days and things like that. So some companies make the investment in community intentionally. I certainly grew up professionally in one. I worked for Hammett, what's now UPMC Hammett, many years ago, and 40% of my job was being involved in the community and advancing community initiatives that Hammett felt were important in terms of creating community health. But those days are gone. Companies, the management teams, and even the staffing is so tight that, the time that we had when we were younger to serve on boards and to really be good management volunteers to nonprofits, where we could actually take on a hands-on project and actually lead it or project manage it, or do a kind of a really good job to staff something that the nonprofit didn't have staff to do. Finding people who have the capacity to do that today is very rare, regardless of age. And although we do have a couple of clients that have just amazing, bright, young management volunteers. They're professional people in their day jobs, but they have a little bit of capacity to give. And if they give 2 hours or 4 hours every couple of weeks, and they take on a project and do something, it makes a huge difference to a nonprofit organization. So that still exists. The problem is that companies and people are just spread so thin, they don't have the time to do that people had 20 or 30 years ago.
You brought up something very, very interesting. What I see is a generational shift, and I'm thinking of great people. Let's start with someone at the top, Bill Gates, and the amount of money he gives away, and then other nonprofits you and I know. It seems like there's not many of those folks left, so to speak. The ones that are around are being very generous. What happens when that totally shifts off base? Is there another layer of philanthropists subsequent to that generation?
Well, there's always going to be a potential for philanthropy in every generation. The question is always going to be, how do we connect with people's hearts and encourage them to give? One of our fundraising consultants, a woman named Francie Ambusky, she talks about the heart of the art of philanthropy. And you have to have red before you see green. Okay, you have to show people what the cause is. You have to get them to experience what the needs are. And if people really see and understand what change will happen because of strategic investment in a nonprofit organization or in a cause, they will give. And regardless of levels, and we've seen that. We've seen that over and over again. And I actually attended a workshop at the PANO conference he was a planned giving consultant that did a presentation on the different generations and how they give differently and how they need to be communicated to in order to get their heart involved in philanthropic causes. So I think that there is going to have to be a complete rethinking and re-engineering of how philanthropy is even thought about and done after the baby boomer generation, because the generations behind think very differently and they communicate very differently. So that's one thing. And the second thing is everybody goes after I'll call it the typical philanthropic people, so every community has a handful of wealthy or very wealthy people who are philanthropic, and then everybody in the world tries to get them to give to their cause. But what most people are missing is there are millionaires next door, and there are people who are ordinary people who can give extraordinary gifts if they're connected and well enough understanding of the cause. So part of the shift in philanthropy is the Andrew Carnegies of yesteryear and the Bill Gates and Melinda Gates of today. There will always be some very, very ultra wealthy people who are philanthropic. There will always be that tiny subset. But in local communities, and especially in northwestern Pennsylvania and in the rural areas of our region, there are many, many people who have some wealth. If you look at the statistics, they would surprise you at how much wealth that we actually have in Pennsylvania, and even in rural areas. But people don't, wear it out on their sleeves, and they don't necessarily give philanthropically in a public way. So in those cases, it's a matter of really getting to know people and really getting people to give smaller gifts more frequent ways and in different ways, and then ultimately having relationships with people where they're willing to give ordinary people are willing to give extraordinary gifts in the situations where they have the means.
I'm going to ask you a two-pronged question. How do we fundraise when the generation of fundraisers is very, very young? And then relative to that, you've already mentioned the age of fund givers, folks who gift. Is there a whole new structure to the way we will raise, or the way we need to raise money?
Oh, absolutely there is. It's going to have to be more technologically based. It's going to have to include relationship building in different ways. However, there are some fundamental principles that will always be the foundation of fundraising. We're just going to have to adapt the communication messaging and the types of relationship building to new audiences. But that said, once upon a time, Tom, you and I were naive young people that were sort of bright and starry-eyed and said, well, we can do this. And one time, and this is years ago, and I probably ought to update my list, I actually wrote down something like 32 people in the course of my career, and that number is higher now, who I would consider mentors, who took the time to invest in helping to shape my thinking, to shape my professionalism, and to help encourage and coach me, especially if I was doing something that was really naive or even stupid. Okay. I had a couple of those what's up talks along, over the years of like, what in the world are you thinking? And that opportunity still exists for young people. And I'll give you an example. Right now, this minute, we have two, I'll call them really seasoned fundraising professionals on our team. Margie Taylor, who used to be the planned giving officer at Penn State Barron, and Francie Ambusky, who I mentioned before, who was for many years the executive director of the Bradford Hospital Foundation. The two of them, in their respective roles, raised almost $100 million for those organizations in the times they were there. And they are actively training and coaching a next generation of young people, okay? And our philanthropic consulting work is doing just that. Yes, we'll provide fundraising counsel and, help people organize and implement fundraising campaigns. But quite honestly, the most of their work is teaching and coaching both the executive and development directors of agencies where a development director exists. Where one doesn't exist, they're training and coaching the executive director, and also working with the handful of board members. And usually it's a very small subset of the board. If we can get, one or two or maybe three board members who are willing to commit to the relationship building work that really can help form and build on major gifts fundraising, that's the work that they're doing primarily. They're training and coaching that next generation of leaders, and that's part of our fundraising work. People are open to the learning. It works very well.
Excellent. Where do you find people, that is young people, who would be talented enough or interested enough to fundraise? I know there's actually a lot of universities that provide courses, and I see young people go to these things, yet I don't see them learning how to communicate with, say, the person that you're talking about in order to adequately raise money.
Well, and I guess I think that experience comes with some seasoning, but I will tell you about a cool project that Jackie and I are doing here in the next couple of weeks for the School of Humanities and Social Sciences at Penn State Behrend. So we had dinner, well, actually we had lunch a few weeks ago with the assistant director of the school, and we were talking about how many students in the School of Humanities and Social Sciences end up in the nonprofit sector, and some of them end up in fundraising and executive director and leadership roles. But they really don't, their curriculum doesn't really have anything in it that describes sort of the career pathways in nonprofits. And, a lot of people end up in fundraising because they care about people. They're good writers, they're good communicators. So people that are maybe English major or literature majors or writing majors or journalism or communication majors, that many of them end up in fundraising. Okay. That's how Margie Taylor got into it. She was a communications major in undergrad, and got involved in community and economic development, and ended up she got involved in chambers and setting up foundations, and then getting involved in foundations, and voila, she's a fundraiser. And Francie ended up in fundraising sort of through the back door. She was a nurse and was running a home care agency of all things, and the hospital wanted to start a foundation, and Francie was like the startup program person. Okay, she had started a home health agency and a hospice, and started a early care and education sort of support program in Bradford, and she was the go-to person for new program development. So this is how people get into development, kind of one of those two tracks, at least from what I've seen in the nonprofit sector. They're good communicators, writers, or they're good program developers or good project managers in other sectors of their role, and they understand the mission well. So they're able to communicate the mission because they have a heart for the mission, or they're just communicators. So the training and equipping, depending on how folks sort of get into it, if you come at it from I have good writing and communication skills, but need to really learn how to communicate the mission, that's a matter of learning, what the nonprofit does, what are the outcomes, and then how do we tell the story in a way that's going to resonate with people, where they say, if this nonprofit doesn't have the resources to do this program, these impacts in the community aren't going to happen. My $50 a month matters, so I'm going to give. And that's really the, I'll call it the storytelling that goes into it. And for, people who come at it from what I'll call the mission side or the technical side, they're already doing something in a nonprofit, and then they pick up fundraising. Well, then now you're going to have to learn the mechanics of, how to write grants, how to tell that story, how to communicate well, and, how to make connections with people.
Let me ask about your staff. You mentioned Jackie twice. Give us an outline about the folks that you work with, that you've handpicked in order to accomplish your good work in the community.
So that list is very long now, Tom, because we have a core group of 6 people that I call our core staff, but we have a much broader group of subject matter experts and consultants. So, but our chief operating officer at Strategy Solutions is Jackie Catcherbone. She and I have been together for over 19 years. She's also our research director, so she takes care of making sure that all projects happen according to the timeline and deadline. But she's also a specialist in hearing the voice of the customer, making sure that we do inclusive processes. All voices are heard whenever we do any kind of planning or community engagement. And she's also our sort of resident expert in program evaluation. So she's helping nonprofits look at their outcomes and impact and evaluate their programs. And part of the problem that many nonprofits have with telling their story is they don't have good outcomes data. So a lot of the work that Jackie does is helping to actually inform that fundraising process so that people can articulate the importance of their cause. So that's Jackie. We also have another new project manager. His name is Shane Oshman, and he's come on our team to learn, as part of my succession plan, quite frankly, and part of Francie's succession plan, to take over, learn the mechanics of the major gifts fundraising and the heart of the art of philanthropy that Francie has been doing, but also to take over my project management with faith-based organizations and churches. We've had a kind of a small subset of our work for many years include working with faith-based organizations that I have kind of personally project managed. So Shane is on board working with us and helping to learn those new things. So he's brand new. He's only been with us a couple of months, so he's working on that. We also have a woman named Robin Morris, who has been with us since 2013, so now 11 years. She's our research analyst and project coordinator, and she's the one that does all of the secondary data collection, mines data, brings it all together, helps us coordinate surveys and focus groups and interviews and things like that. So she does a lot of behind the scenes work, but it's all really, really important to our work. And then our two fundraising consultants are Margie and Francie that I mentioned. And then our business manager, even though she keeps telling me she's not our business manager, she's our graphic designer, is a woman named Ann DeVecchio, also who happens to be my daughter. So she is a graphic designer par excellence, and she is the one that makes all of our products pretty and puts our reports together to kind of tell the story in a nice visual way. And then we have a whole variety of strategic relationships with other firms, other consultants, and other project management experts in the various disciplines that and I can go on for about 45 minutes about all of those people. But we have a team now, I think, of 28 or 29 different consultants that we work with that are subject matter experts that we'll bring into a particular project for a particular need.
Over the half dozen or more areas that you espouse your expertise in, one is very interesting to me anyway, and that's the healthcare industry, which you have a lot of experience in. What's going on? What's the status of that whole mechanism? Is it the same relative to fundraising? Services have changed. A lot of conglomerates now. It's interesting to travel, say, to Cleveland and see the same name on 24 buildings. What are your thoughts there?
It's interesting. The whole evolution of the healthcare industry over the last 20 years has been fascinating. And our healthcare delivery system is, unfortunately, it's just an enigma because it's grown up from a hodgepodge of different things, and now it's, very complex, and people are now trying to make it work. But the thing that everybody needs to know about what's happening in healthcare is that systems have formed because the technology, the price of research and development and the cost of technology and keeping up with the technological advances is way too much for any single independent organization to sort of bear on its own. So healthcare systems have formed and have created integrated financial delivery systems with insurance companies because they've had to, you have to have enough cash for your next strategic investment. And the only way that you're capable of getting that is to be able to create economies of scale so that you can lower your cost of you can standardize your practice, you can lower your cost of operations, and working together, hanging together is certainly better than hanging separately because you end up going out of business. Okay. So that dynamic is going to continue to evolve. And what a lot of people don't realize is that hospitals, especially, many of them right now are in a world of hurt financially because they have never recovered from COVID. Okay. They don't talk about that a lot, but hospitals are very focused on um, delivering high quality patient care and really trying, making sure that their operations are sound and they can actually keep operating. Insurance companies, on the other hand, they benefited greatly financially from COVID, because there was no utilization for so long in any type of outpatient setting. So that loss of revenue, even with the subsidies that came from the federal government to help shore that up, it really didn't cover all of the costs that the hospitals bore through that time. So they're very much focused on staying open and trying to be sustainable and continuing to keep up with technological advances. So that's all happening. And then we have, there's another sort of new trend that's happening in healthcare, which I'll call medical entrepreneurship. There's a lot of that happening these days, where medical, and this is good. This is good for the economy. This is good for communities, where medical research is spawning off new technologies that are creating, investment in new technologies and new softwares and new medical devices and things like that. The Pittsburgh region has benefited greatly from that kind of technology transfer through the University of Pittsburgh and Carnegie Mellon University for many years. And we're now starting to see that kind of thinking now come to Erie, which is really exciting, with the collaboration between UPMC, Hammett, and McGee Women's and Penn State Barron. If you're familiar with that investment that was made into the cancer research a couple of years ago, there's great promise for that continuing to evolve into other kinds of tech transfer and new cancer treatments and other things like that, down the road. There's lots of promise for those kinds of things. And communities that are smart are recognizing that there's, economic development opportunities associated with that and entrepreneurial opportunities. I know a number of doctors who have started, and other medical practitioners who have started either medical device companies or medical services. For example, a couple of years ago, we did a kind of a market positioning study for a doctor who was his emergency department doctor, and he created this really cool program of an approach to keep people out of emergency departments that didn't have emergent problems. Okay, and we met him because he was a strategic advisor to a program that we're evaluating in Alaska, of all places. His company is actually located in Seattle, but he called me one day and said, "You're doing really great work for our joint client in the Matsu. I'm starting this company. I'm trying to position it. What do I do?" And my advice to him was, "I think you're trying to sell to the wrong people. Emergency department doctors aren't the ones, even though they're the ones who would benefit from the service that you're providing, and you're an emergency department doctor. Who you really need to sell to are insurance companies and to states, believe it or not. States Department of Medicaid, who are programming services." And we did a little research study for him with people who we thought would be in his target market, and got some interviews about how to position that company. And I hooked him up with some marketing, communications, and sales professionals who could really help his company. And he has a pretty sizable contract with a state Department of Health, and he has a number of other kind of important contracts that he's been able to get out of that. So we have that kind of entrepreneurship happening. I know another person who's trying to sort of build a virtual training program for advanced practice professionals based on their work in a particular health system. So and I helped a doctor a few years ago create a scribe company that they successfully built and operated, kind of as I'll call it a little side hustle from their day job.
Fascinating. Where do you see the greatest need in communities? Medical, obvious. Anything else you see as important to help communities survive in all this change?
So I could talk on that question, Tom, for the next 3 hours, okay? Because communities need so many things. And we could talk about the particular individual topics and things, for a long time. But the way I'll answer that question is I'll answer it based on the reason why Strategy Solutions approaches work the way we do. In order to have healthy communities, we have to have healthy people, we have to have healthy organizations, and we have to have healthy systems in communities that work together across sector in order to thriving. Okay? Mm-hmm. So obviously people need to be healthy. And our work at Strategy Solutions is with the organizations that serve people, processes, and practices. So we serve, and we work cross-sector for this reasons with individual organizations so that organizations are healthy. But we work cross-sector with private sector wealth creating companies. We work with nonprofit companies, and we work with community governments and infrastructure. Because if we want to have healthy, thriving communities, we have to have the infrastructure and the environment in order for people to be healthy and happy in their environment. So we have to have things like roads, water, clean water, sewers. We have to have parks and recreation. We have to have all the things that make a community a good community. Okay, so we need that sector to really work well and to make sure all those things happen. Then we also have to have support services and services that serve people, whether they're for-profit companies that do things like, sell goods and services for people to have what they need, grocery stores, restaurants, and, all the things that we need as people. We need construction companies that build houses and renovate houses. So we need all of that. And then we also need our nonprofit sector to provide program services, education, and things that people need if they're struggling with anything. So all of those things actually work together in tandem to create healthy, thriving communities. And in some cases, the systems themselves are failing, and we do interventions and help the systems thinking in communities sort of work better to create an overall better community.
Debra Thompson, what an outstanding opportunity for me to be able to talk with you. Every time I've spoken with you over 20 years, I've learned something new, and you are an incredible benefit to not only our community, but other communities across the country. Thank you for taking time out of your busy day to sit and chat with us. We really do appreciate it.
You are most welcome, Tom, and I always enjoy talking to you because you ask really salient and provocative questions, so they're fun to talk about and answer. So thank you.
I've learned how to ask the correct questions from you, the expert in the field. Thank you for that compliment, though. We'll look forward to talking with you again sometime. I hope you'll join us.
Always willing to come back, Tom. You're always great to talk to, and I appreciate the work that you do with We Question and Learn.
Welcome to We Question and Learn. This is Tom Pies. We're celebrating our 20th year here on the air at WQLN FM 91.3. We're on about a dozen or more podcast venues. I've discovered several more as time goes on, and we're fortunate enough to have great guests, interesting guests, people that are pertinent to Northwest Pennsylvania. But also, as we are on these venues, I get a couple of calls from around the country asking about what's happening in Erie, as they would like to maybe collate their experience with things that are happening here. And with me on the phone is Erin Wrenak. Erin, thank you for being here with me today. And a belated congratulations on your job, because you've been there 2 years now?
Correct.
Yeah. And we're certainly glad that you're in that position. You have a good deal of experience. I believe you were with Stairways Behavioral Health prior to this job.
Yes, that's correct. I was there for about 12 years.
Oh, okay. Director of Addiction Treatment Services?
Yeah.
It's quite a responsibility. How did you get involved in the health industry? What was your draw to helping people?
I've always liked that, but I also have a real interest in science and have a science background. So when I first got into behavioral health, I realized how much what I learned about the brain, my bachelor's degree is in neuroscience, how much that applied to what we were trying to do to help people and help them understand what's going on with their brains and how their medications work. So for me, it just was the right fit.
You're a graduate of Allegheny College. What a wonderful place. That's just a fantastic little campus. It's a challenge to be there. I understand that the gauntlet is a little tough at times in order just to get through the curriculum.
Yeah, it was a great school. It was very challenging, but we had great professors, and the environment is awesome for learning.
How did you get involved with neuroscience? A great topic.
I think it was just an accident, to be honest. I've always liked science, and I needed a spot to fill in my schedule, and I'd heard good things about it. I also have a double major in psychology, so I had a professor that encouraged me to take that class, and once I took the first one, I really, really enjoyed it. So I switched focus and went after the double major to have the focus in both areas.
So as you graduated from college, did you move over directly to your next job subsequent?
Yeah, I actually ended up working in residential treatment for adolescent girls locally in Erie when Gannondale was still around. Many people in the behavioral health field, when you don't have a ton of experience, you end up working in residential treatment to get those first couple of years of experience. And then from there, I moved into more of an outpatient behavioral health setting and really took to the addictions treatment and kind of worked my way up the ladder from there.
So you didn't go straight from college to Stairways. You were at Gannondale.
Correct.
In between. Mm-hmm. That was a wonderful organization, as you know.
Yeah.
You did a lot of good work out there. Is that still in existence? Forgive me for not knowing.
No, it is not still in existence. It actually currently is the home to an addiction treatment center. They converted it to a residential facility. They have a small detox unit and some inpatient treatment there.
So you've been at the county health department for the last couple of years. How did you move into that position?
Yeah, when I was when COVID hit, I really felt the need to help on kind of a different scale. And in behavioral health, you work a lot with individual patients. And so public health was very appealing because we're helping our population cope with things that were happening. So that's what prompted me to make the move from behavioral health into public health, though there are a lot of overlaps between the two. And they were in the middle at the health department of a rapid expansion at that point, trying to respond to the growing needs of the pandemic. So they had created some new divisions and positions, and I came over as a director in one of their new divisions. And then shortly after I came on board over there, I think November of that year, I started in February, was when Melissa Lyon announced that she would be leaving to start a new health department in Pennsylvania out in Delaware County. So at that point, I kind of moved into the director role with the change of administration in Erie County.
Spoken with Melissa many times. What a wonderful and talented individual, as you know.
Yes, she was a great mentor, and we've kept in touch since she's left.
So as you are in your work environment, where physically is your office?
Our office is 2nd and Cherry Street, so we are right at the foot of Cherry Street, kind of overlooking the bay.
Wonderful, wonderful. How many people are working there?
Right now, we have 68 employees, though we do have some vacancies. So we, if we were fully staffed, we'd probably be at 73 or 74 employees.
Wow. So talk about the departments. That's a lot of folks working for our area.
And we're structurally broken up into 4 divisions. Our administration division, which houses our fiscal services, IT, customer service, and just kind of our operational strategy. Decisions happen in that division. We also have an environmental health division, which is a large division. They handle all of our permitting, licensing for septic, restaurants, pools. They are very, very busy and out in the field all the time. We also have community health services division. We do community-based STD testing, HIV testing. We have a tuberculosis clinic. We have an immunization program, and we have a nurse-family partnership program. So we do quite a bit. That division is very robust as well. And then we have a health improvement and preparedness division that handles all of our health promotion, our health program activities. They also handle any public health emergency preparedness. So we really worked to kind of bulk that division up during and then kind of where COVID is at right now, recognizing the need to stay prepared in case something changes with COVID or in the event that another disease state hits and we have to formulate a rapid response.
How did COVID change things for you? You did not all go into the office. Were you working from home or were you just segregated?
Most of the time the health department was working from the office. We did a lot of Zoom calls, even from our own offices, so that we could meet together. We did have a component of our staff that did work from home at that time, but that did not last very long for us because we were constantly on the phone, especially early in COVID, when there was a very heavy focus on contact tracing, isolation, and quarantine. We pretty much, the entire focus of the health department shifted almost overnight, and they kind of had that response where they divided up the new responsibilities and went from there. And then we worked with the county executive at the time and county administration to, they were the ones that set the policies from who could do remote work and who couldn't at that time.
That's phenomenal. That had to have been very difficult and somewhat nerve-wracking. I can't imagine. The stress must have been overwhelming. And I know you folks did an excellent job, especially with all the questions that came up. Did you get help, say, from the state and federal government relative to COVID-19?
Yeah, we worked very closely with the State Department of Health. We actually worked very closely with them on a lot of our initiatives. So there were oftentimes daily calls or information coming from the state or from the CDC through the state to all the local health departments in Pennsylvania. We happen to be one of the two local health departments in Western PA, the only other one being in Allegheny County. The other 9 health departments are in Central and Eastern Pennsylvania.
Did you folks share information, or was the stress different in every community?
I think it was a little bit different in every community, though there were state guidelines that we were all tasked to follow. And we do work closely together with other local health departments. We meet even now every month with all the local health department directors to talk about common issues, trends we might be seeing, things we might need to be aware of. It's been a great community to collaborate in.
Thank you. That was my next question. How often do you communicate? And you obviously have a good deal of rapport with these folks. They share important information with you.
Yes, and it's nice to have a group of people. Everyone's local government works a little bit differently, but we all have the commonality of working closely with the State Department of Health. So we also have a monthly leadership meeting with the State Department of Health where we have the opportunity to put agenda items on there from the local perspective. So it gives our communities a voice at that state level table as well.
Are the differences due to population, geographic separation of communities? Is Erie different just because we're more cohesive, so to speak, than a small town in, say, central Pennsylvania?
I think because the government structures are different in every county, but also, you're right, in Philadelphia and the surrounding areas, they may be dealing with different situations where we do have a significant portion of our county is in the rural communities. So we have different issues that we may be facing than other health departments. But there also are some commonalities, so it's nice to be able to talk about programming across the different health departments to get ideas for things we might be able to do here that would benefit our community.
Talk about your clinics. How does that work?
So our clinics are open to anyone that does not have insurance or is underinsured, especially for immunizations. We actually do have guidance under whom we are allowed to vaccinate. We also have a Vaccines for Children program. So we are very busy actually during back to school, and we're just starting to slow down now for kids that are trying to get caught up on their school vaccinations to be allowed back into the classroom. So we are typically very busy this time of the year making sure that kids can get back into school.
I see this word mpox. I've read about it. What's your take on that? What are your services relative to that? Where are we with that topic?
We saw cases initially when mpox happened 2 years ago. We had less than 10, and we have really not seen additional cases since then. We do have vaccine for it available, but we are that vaccine is not one that's stocked in other areas, so there are criteria that persons have to meet in order to be eligible for that. And if people have questions, they can absolutely call our immunization line, and we reach back out to everyone to find out if they're eligible and help them locate resources.
I'm going to go back to almost 65, 70 years ago, and we would get tuberculosis vaccinations. Is that the correct term? What's that like today?
We do tuberculosis testing. And we case manage folks that may have latent or active TB. But I definitely, if you have more questions about the TB program, I definitely would want you to talk to one of our nursing supervisors in that program, because she is an expert in all of those things.
Great. But it's an active and important part of the health department. Yes. Great.
And it's something that there aren't services available for that in other places, so that service is unique to our health department.
And on an educational point of view, sexual health, very important. Things are difficult sometimes. You folks do a lot of work in that area. What is the program like?
So we offer free and confidential STD testing through our clinics, and people can get access to appointments, how to do that from our website, or they can call us. We also work really closely with other local providers of STI testing and treatment. So it's not uncommon to have referrals back and forth. One of the things that's very unique to public health is we are responsible for surveillance of 74 communicable diseases in our county. So we have a team of disease investigators or disease intervention specialists that use that surveillance data, and we reach out to people to make sure that they're getting the services that they need, that we may be preventing the spread of that disease depending on the situation. So each disease has a specific process that we follow to help mitigate any spread of that.
I plead ignorance. I didn't know the number of diseases was such a high number.
Yeah.
I'm going to have to do some research. That's a little scary. That makes your job even more difficult, I'm guessing.
Thankfully, we don't see the bulk of them on that list, but we do have a plan in place for how we would respond to that or help individuals that may have contracted those diseases.
Okay, you're all prepped up, ready to go. You're very knowledgeable. Yeah. You're doing the important things right away. Anything else that crops up, you're in a good position to help. I know a lot of folks would like to know a little bit about your licensing permits. What type of permits are most prevalent? What is the crux of your licensing and permitting and inspection activities?
So we license any restaurant in Erie County or a food truck. We do licensing for all of those, which is an annual inspection, which we have a very strong team of inspectors that go out and do that. We also license and inspect tattoo parlors, schools, public pools, public campgrounds, just to make sure that those rules are being followed and that people will be safe with food and drink in those locations.
Now I'm getting... sorry. Go ahead.
We also permit septic treatment facilities, and we receive a lot of applications on those, and there is also follow-up on those types of permits, depending on the type of facility that it is, how often those are conducted.
I'm beginning to understand why you need as many employees as you have. Is it
that environmental health team is very busy.
Yeah. Is it difficult to get people? Maybe college students would be interested in this, I'm sure. They just need to contact you if they're interested, right?
Yeah, and all of our postings are listed on our website. We typically we don't have a lot of turnover in our environmental health positions. Our biggest struggle for staffing, as is in most places right now, is nursing. Finding folks to be public health nurses has been one of our larger challenges.
How do you relate to the schools? How does that work?
We work collaboratively with the schools. During COVID, we had much more involvement than is typical because there were very specific guidelines for schools. So we worked very closely with the IU5 and with the superintendents. We had regular calls with the superintendents group to go over guidance, answer questions. We were being sent their health and safety plans to make sure that those met with COVID regulations. So we do have a very good relationship with our school districts in Erie County.
Now you're gathering a lot of data. How do you collate that? Do you have a system at your office? Does that interface with the state and the federal government? How does the data scenario
Yeah,
work?
we have a number of systems that we use. Probably the biggest one is the state surveillance system for those communicable diseases. And then our staff here are given permissions by the state to have access to that system. And then we work closely. We have epidemiologists on staff here. We currently have 3 that do a lot of our data analysis. And one of the things that I'm very proud of that we've done in the last couple of years is we've really worked hard to modernize how we're presenting data. And we currently have some new dashboards. We're actually rolling out a new one that's available on our website right now for our respiratory disease season, which will show COVID cases, flu A and B, as well as RSV. And there's also a page to show those wastewater levels, because we're currently still monitoring levels of COVID, flu, and RSV in the wastewater. So it shows us trends and what's happening in the community.
So is that accessible by anyone, or is that just for medical, physician, hospitals?
No, it is available. None of it has any personal health information. It's all, and wastewater data is completely anonymous. We work with our wastewater treatment facility to send samples to the lab that we're contracted with, and they basically run PCR testing on samples from the wastewater treatment facility, and it shows levels of virus in the wastewater. So it gives us trends so we can see if there's more COVID spreading in the community, and we look to see then if that's corresponding with any hospital increases we might see, or if we're getting more calls or things like that. It's been a great tool for service.
We have some wonderful hospitals and educational facilities here in Northwest Pennsylvania. Do you communicate with them often? Do they call you? Do you share data?
We do share information, and again, that was one thing that we greatly benefited from, was the relationship of providers that we have. We worked very closely with our healthcare systems during COVID, and there's been other situations that have come up in which we've been able to tap into those resources and work closely with our contacts there to have a response to a disease or a situation. So those relationships collaboratively have been very, very helpful.
This may be a tougher question. Let's say you find something stressful. How do you communicate all that? I'm sure the media helps you out, but let's say you want to put a warning out. What's the procedure?
Yeah, we have a couple different ways we can do that. We use our social media quite a bit. We often put out media releases. We will do interviews to try to get information out. We also have a system where we can fax any information to any licensed healthcare provider in Erie County. The state also puts out what's called a PA HON, which is the Health Alert Network. If there's something happening that they're putting out an advisory or an alert, we can send those all out. Or if we have specific information, like recently there's been a lot of products contaminated with lead, and we wanted to make sure our pediatrician offices were aware of that and try to promote testing for lead levels for children. So we can tap into that system to notify folks. We also have a Board of Health. That's an advisory board for us. We use them, and we do have 3 physicians on our Board of Health that help us communicate information to the places that they work as well.
You're right on the ball. You're getting all my questions answered before I can get them out, which is a compliment to you and your organization. Does your team, do they all meet together on occasion, or is it more departmental? How is the organization set up? Is it communication is needed or in groups? How does it work?
I would say all of the above. So our directors team here meets every week. There's always a lot going on, so it's a way for us weekly to check in and make sure we're all aware of any pertinent things going on. Each division meets monthly with the staff in that division, and then we also have a once-a-month all-house staff meeting to go over larger department-wide things that people need to be aware of. So we try to meet with staff whenever it's feasible, but with that amount of people, it's often tough to get everyone in a room together, but we do the best we can to make sure the team gets together at least once a month.
Is there a call to action to the media? Do you have a system? Or is it, well, we have a problem, COVID being one example? How does that work?
Usually if it's something that's a larger scale, we'll often work with the County of Erie's Public Information Officer. And we have a communications specialist in-house at the health department, but for any larger scale issues, of that size, we're working very closely with county administration and the PIO there to help us get information out as quickly as we can.
If people wanted to talk with you, maybe they have a question, maybe there's some advice they're looking for relative to their children or the elderly, how do they find you?
We are very easy to find if we're Googled. Just make sure you're looking for Erie County PA Health Department, because there are Erie County Health Departments in Ohio and in New York.
Yes, we're surrounded, yes.
Yes, so you can find us. There's information on our website of how to contact us. There's an email address there. Or you can Google our phone number. Our customer service staff will always be happy to help get people to the right person to talk with.
Last question, as far as funding and operations, how does this all work? Is this all county funded?
No, we actually have quite a variety of funding streams, most of which come in the form of grants or intergovernmental agreements with the State Department of Health. Only about 15% of our funding comes from the general fund in Erie County. So some of our funding comes from, it's called Act 315 funding, which is a local health department funding, and then Erie County does a match for that. And then the rest of our fundings comes through, like I said, those grants or intergovernmental agreements, which are program-specific funding dollars that have metrics that we have to meet to maintain eligibility for those funds.
So you're doing some development work, maybe not a lot, but obviously enough because it is critical. I didn't realize how small your budget came from direct governmental sources.
Yeah, so we do a lot of work to make sure our funding stream is diverse. And we're always looking for new grant and programmatic opportunities that we could support that would benefit the community here in Erie.
Just to ask one more question. On the federal level, on the national level, do you folks talk often, and do you get help from the federal government?
We don't typically interact directly with the federal government or even with the CDC directly. I know in the past, and from working with other local health departments, there are times when the CDC or the federal government will step in dependent on the scale of the issue. But since I've been here, that has not happened. Typically, most of our communication to the federal level is coming through our state Department of Health and then down to the local health departments.
Fantastic. Any thoughts about where you'd like to improve services, if that's even possible, for our area?
I think we're looking a lot into expanding our environmental health services, especially being so close to a lake. We're the only health department in Pennsylvania that has the great resource of Lake Erie. So we do currently monitoring beach water and for harmful algal bloom. So we are, and that we work with EPA and Pennsylvania DEP on those issues as well. So that's always an area where we may need additional resources. So we're on the lookout for that. And we're currently in the middle of doing our community health needs assessment, which is the first one we've done since COVID hit. So there's a survey out there that community members can take. It's free. It takes about 15 minutes. And really trying to get the community's feedback on where they see the health needs and in the community. And that will help us drive our community health improvement plan, which is where we identify the top 3 to 5 areas where we need to focus in the next 3 to 5 years. And then that helps us go after funding potentially or restructure internal resources to target those areas. Again,
some encouragement to go to the website. I see you have a calendar that is full. I'm looking at a lot of activity. Do you plan that? Does your group plan that?
Our group does plan that, and they keep it up to date. That was a newer thing we added during COVID. Also, because we were contracted with a number of other entities during COVID, it allowed us to put any COVID vaccine clinics or free testing services into one place so people could click on one calendar and see where they might be able to go to get help.
Sounds like if we go to the website, we'll find just about everything we need and someone to contact as well. So
absolutely.
This is really well done. I want to thank you for your patience and this opportunity to have a chance to speak with you. It's been an interesting couple of years for you, and I'm sure you have some challenges for the future. We wish you all the best, and a hearty thanks for taking the time to sit and talk with us today.
Well, thank you very much for having me. I really appreciate it.